Just published September 4th, 2025, the American Urological Association's newest guideline on recurrent uncomplicated urinary tract infections in women. The objective of this guideline is to establish guidance for the evaluation and management of patients with recurrent UTIs to prevent inappropriate use of antibiotics, decrease the risk of antibiotic resistance, reduce adverse effects of antibiotic use, provide guidance on antibiotic and non-antibiotic strategies for prevention, and improve clinical outcomes and quality of life for women with recurrent UTIs by reducing reoccurrence of UTI events. In today's video, we'll just be going over key takeaways and changes from the 2025 update on the sections: evaluation, asymptomatic bacteriuria, antibiotic treatment, antibiotic prophylaxis, non-antibiotic prophylaxis, follow-up evaluation, and estrogen. So to get the full recommendations, make sure to check it out on guidelinecentral.com. Starting with evaluation, there were changes to 2 out of the 6 evaluation recommendations. Recommendation 3 was updated regarding making the diagnosis of recurrent UTI. Evidence should be documented of inflammation and the presence of uropathogenic bacteria in association with symptomatic episodes to diagnose recurrent UTI. Recommendation 6 for patient-initiated / self-start treatment was changed to a conditional recommendation. The 2 recommendations for asymptomatic bacteriuria were unchanged from the previous guideline, as well as the 3 recommendations for antibiotic treatment of recurrent UTI remain unchanged. The recommendation on antibiotic prophylaxis also remains unchanged. For the section on non-antibiotic prophylaxis, recommendation 13 was changed from clinicians may offer cranberry to clinicians should offer cranberry for UTI prophylaxis. 3 new recommendations were added. Recommendation 14, supplements containing only D-mannose may not be an effective prophylaxis for women with recurrent UTI. Recommendation 15, methenamine hippurate may be offered for prophylaxis in women with recurrent UTI. Recommendation 16, women with recurrent UTIs who drink less than 1.5 liters per day of water may be offered increased water intake for prophylaxis. For follow-up evaluation, a new recommendation was added. Recommendation 19, clinicians should evaluate for an alternative cause of symptoms in women with persistent UTI symptoms after microbiological cure. And last, the recommendation for vaginal estrogen to prevent recurrent UTIs in perimenopausal and postmenopausal women remains unchanged. And there you have it. Make sure to check out the full guideline from the American Urological Association and other related clinical decision support tools at guidelinecentral.com.